So I'm very excited to chat with Dr. Melinda Ring, and I'm going to dive into her impressive bio, and then we're going to talk about culinary medicine. So, Dr. Ring is director of Osher Center of Integrative Health and clinical associate professor, departments of medicine and medical social sciences at Northwestern University Feinberg School of Medicine. She has an active clinical practice, directs medical trainee education and clinical and faculty fellowships in integrative medicine, founded the Cooking Upheld Culinary Medicine course, and conducts research as well. And Dr. Melinda contributes to textbooks, research articles in the field of women's health and integrative medicine. She has published several books on integrative medicine, including The Natural Menopause Solution, and she is a frequent contributor to news outlets. She is chair of the board of the American Board of Integrative Medicine, and in 2021, she received the Bravewell Distinguished Service Award from the Academic Consortium for Integrative Medicine and Health, which is one of the highest honors in the fields of integrative health. And Dr. Melinda, thank you so much for joining us.
Yeah, thanks for having me. Looking forward to our conversation.
Yeah, same here. And so before we dive into culinary medicine, if you could just give a little bit more of your background. How did you start really focusing on that?
Well, I think it's an interesting question because if I think back to my childhood, I grew up in the 70s, 80s, and food was very much processed food and Wonder Bread and TV dinners, and that's what was healthy. And so I never actually learned how to cook. And I think what we knew about nutrition is very different from what we know about it now. When I had a brief window of time between college and medical school, and I begged my way into getting a job as a sous chef at the fancy restaurant in Ann Arbor. So then I spent the summer making salmon and papillotes and making our own sausage from scratch and doing a lot of different things that I had never learned before. And then when I went to medical school, we learned nothing about nutrition. Really, it was all about the only real nutrition we had was about IV nutrition for inpatients. And even when we were talking about diabetic patients, where diet makes such a difference, we learned about how to dose insulin, but we didn't learn how to counsel patients on what to eat. And then when I was in practice, even then, I knew tell somebody to eat a low sodium diet or do whatever, but nobody knew, that giving them a handout doesn't translate to real world nutrition. So after my integrative medicine training, which was really, very nutrition focused, as you know, then I started to think about bringing those together. And then that's where this idea of marrying culinary medicine, which has been defined as the art of cooking, combining the art of cooking with the science of nutrition and medicine, really appealed to me. And we decided to create a course in that for health professionals, so we can try to train more doctors, more health professionals to help their patients down the road.
Very cool. How long you been doing that as far as helping other healthcare practitioners incorporate that into their practice?
Oh, probably for the past 8 years. We started a course at Northwestern, and now we've expanded it, and it's being taught at other institutions. And it's not a patient directed, so I do get inquiries, right? About, oh, how, even from my own patients, how can we take your culinary medicine class? And right now, that's not what we offer, although there are definitely others that offer things like that. I might do that myself down the road, but right now, Cooking Up Health is really aimed at making sure people's doctors and their other health professionals understand culinary medicine so that they can help their thousands of patients.
And is it mostly other integrative doctors, or do you actually get conventional medical doctors who express interest as well?
Yeah, no, it's actually, we're trying to start early. So, in a few weeks, we're starting a cohort of first and second year medical students. So they're going to go into all kinds of fields, and nutrition's relevant to everything from, surgery to dermatology to primary care. So it's definitely focused on everybody, not just integrative doctors.
Yeah, that's wonderful. And how do you incorporate it into your actual practice then? So it sounds like you don't actually teach your patients how to cook. You just encourage them to, uh, to eat whole healthy foods, of course, and just do you encourage them to
Yeah.
like recipes? Yeah, if you could talk more
Yeah,
about
to
that.
some degree. I think certainly nutrition is always a part of what I talk to about patients. Um, and yes, providing resources for them. I tend to have a very educated, health oriented patient population. And so they tend to already be aware to some degree, but it's really diving more deeply into how do we make this a practical thing in an already busy life. We can't do cooking that takes 3 hours to prep when somebody has other things going on, or when I have a patient who has two jobs and is raising kids, telling them to use this fancy cookbook to prepare food is just not going to work. So it comes down to what are some of the quick and easy ways to make healthy nutrition realistic and delicious.
Makes sense. And batch cooking, do you also recommend batch cooking
Oh,
also to save time?
batch cooking, absolutely. Prepping, there's a cookbook I got recently by it's called by this nutritionist or cook, Love and Lemons, and in it, for example, she'll say like, okay, here's you have a lot of zucchini. You just got the organic zucchini from Costco, and you have a whole bunch of it. Here's 3 recipes, 3 nights of completely different recipes you can do. So you prep this on day 1, then you'll use this day 2 and this day 3. Those are the kinds of things that I think help. And they also help reduce food waste, which is such a big issue in our country. And people come in with these great, they're like, yay, I'm going to get all of these things. And then the end of the week, they're in the bin because they're starting to not look so great or getting a little wilted. And yeah, so I think helping people learn to avoid some of that food waste is important too.
How important, in your opinion, is food when it comes to not just overall health, but just like when dealing with health conditions such as, again, that the listeners of this this interview here pretty much consists of people with thyroid, autoimmune thyroid conditions. So like what role would you say that food plays in helping someone to recover, or even other health conditions, other autoimmune conditions such as cancer?
Yeah, well, to me, integrative medicine is it always starts with lifestyle, and diet is one of those pillars of health. And I love dietary supplements. I love other approaches like acupuncture and energy therapies and all of that. But those will do very little if somebody's not also addressing nutrition, getting enough sleep, moving, managing stress, having joy in their life. So it's essential, basically. I think it's critical both to feeling better with whatever you're dealing with now, but also it's one of those root cause things, which is having a healthy diet will prevent disease down the road. And so that's it's it. You got to start there.
Yep. Good answer. Good answer. I agree with that. And so one question I have is picky eaters. So growing up, I
Yeah.
always used to be really picky. And I guess even these days, I'm still more on the picky side, definitely eat more variety. But how do you deal with picky eaters as far as, someone who like, what do you use a lot of spices, I guess, to like make it more flavorful? And yeah, if you have any feedback for those listening who might be like, "Oh, I just like to eat. I just want to have my burger and whatever with their burger. Hopefully not French fries, but I just want to have these foods. These are the 5 foods I'm eating, on a regular basis.
Right.
Maybe eat like a vegetable or two." How would you, if you could give some advice on how they could maybe increase the variety ways that you recommend to your clientele?
Yeah, well, I've grown up. I have two boys, and one of them's a picky eater, uh, and I think it depends what we're talking about. With kids, it's a very different situation than we're talking about a grown up. So, um, with kids, it can be anything from, because the bottom line is you need to get in those vegetables and fruits into the diet. And with parents, getting those things started early when they're developing a taste for it is important. So um, now I'm a little bit of a purist, and maybe not the best example, because I actually prefer all of my vegetables and fruits without a lot of sauces, without a lot of spices. Like, I love them just in their natural taste, maybe like steamed or roasted, but not with a lot of stuff on it. And But I think, for other people, trying to just, for example, if they're pasta lovers, you know adding it in to that, even if it's like frozen vegetables, and just sort of mixing it in, doing muffins and making them zucchini muffins and hiding it in. So finding ways to incorporate it. Smoothies are always a great way. People love to get things in that way. I don't love the uh, like fruit and veggie blend powder type things. I don't think they're a replacement for real food. Um, but yeah, so it does go back to that. You know, it takes a while to develop a taste for something new. So if somebody's been eating a very restricted diet, sometimes they just have to give it a chance and say, like, I'm going to commit to eating this at least 3 times before I say I don't like it. And even if it's like one piece of broccoli, uh, you know, allow their taste buds to adapt and sort of appreciate it. Maybe eat it mindfully, like, notice it more, appreciate it more.
Yeah, those are good points, and that describe me because again, growing up, I really didn't eat vegetables, and so as an adult, I wasn't crazy about eating vegetables. But then going through chiropractic school, learning about nutrition, and realizing, yeah, I need to start eating healthier and incorporating vegetables,
Yeah.
and it was a slower process. And like you said, a lot of it, just the mindset, mindfulness around eating them, and realizing how much good it's doing to my body. The smoothies, you mentioned the smoothies, which I still to this day incorporate smoothies into my practice. So yeah, because you're all right. I mean, it's best to start when you're young, but I still come across adults, and I'm sure you do too, where they're hardly eating any vegetables, and some are. Yeah, I mean, some listeners to this, I'm sure, absolutely love vegetables, but when someone just refuses to eat vegetables, and it's more of a challenge. And you also brought up the powders, because I've had also people bring that up too, just as a substitute. What can I have? Just like the a veggie powder, veggie and fruit mix, exactly what you said. And I tell them the same thing. I mean, it's probably better than nothing, but it's definitely not the same as eating whole vegetables and fruits. And
Yeah,
you mentioned,
there was just in sorry to interrupt. There was just
no,
in
that's okay.
Consumer Lab, I think consumerlab.com did a review of them, or the FDA came down on them, because they'll make these claims like, has 12 to 14 servings in a single drink, and they tested and it was like totally not true. So so there's definitely some false marketing happening there.
Yeah, that's good to know. I didn't know you said consumer
Consumer
reports or
Lab.
consumer labs.
No, consumerlab.com. Are you familiar with that
Yeah,
site?
I'm familiar with
Yeah,
consumer labs, yeah.
yeah, yeah. So, they review, test the quality of supplements and see if they have what they're supposed to have, and don't have things they're not supposed to have, like heavy metals and things like that. So that's another resource I oftentimes will recommend to patients for supplements. I think it's one of the better ones.
Yeah, thanks for sharing that. And you also mentioned as far as when you eat food, sometimes you'll steam them, sometimes you'll roast them. When it comes to vegetables, do you also eat them raw too? Do you like recommend a combination of raw veggies along with cooking, or is it mainly cooking?
Y- No, well, I think it varies, and when we talk about things, it depends on the patient really, because I don't only see autoimmune issues. I see all kinds of things, and so a lot of my patients have gut issues, and they may do better or worse depending on what their situation is with raw versus cooked. Cooking alters the nutritional content of food. It alters its availability, sometimes in positive ways and sometimes in negative ways. When we talk about something, for example, like goitrogens, which are a big topic in thyroid, cooking degrades them. And so in that case, cooking may be the preferred option versus eating a bunch of raw broccoli dipped in a dip. So I don't have a universal only eat cooked, and I'm certainly not a raw foodie either. I like it all, but for patient tolerance, it really depends on their situation.
Yeah, that makes sense. So if someone's experiencing a lot of bloating when eating salads or cruciferous vegetables, then it's probably better for them to, at least for the time being, to cook them. And on
Yeah.
the other hand, if someone's fine eating salads and eating other vegetables raw, then it sounds like you just go with the flow and just let them continue eating the vegetables raw, just how pretty much how they prefer it and how they're as long as they're able to tolerate it without any symptoms.
Yeah, I also am envisioning also this sort of shift to a more integrative culinary medicine movement. And so for example, if we think about Ayurvedic medicine and how it describes people as having different doshas and different combinations of doshas. In Ayurveda, somebody who has a pitta, a more heated dosha constitution, they may do better with raw, cooler type foods. And somebody who is more kapha may need warming, cooked foods. And so I think that there's just different ways of looking at food and food preparation, and at looking at what's right for somebody. It's certainly what feels good to you, but then I think it can go even beyond that depending on what is the lens through which we're looking at food.
And then one thing I didn't say in the beginning, are you a vegan or just vegetarian or?
I like the term plant forward, plant based more than vegan, which tends to say like, oh, you're not going to eat, I'm never going to eat this, versus like, I'm going to eat a lot of these great, lovely plants. Um, I do have some dairy in my diet, not a huge amount, but I do. And certainly some honey, occasional eggs. So I'm not completely vegan for sure. And I think for me, it's a combination of health, um, sort of like connection to the world and being an animal lover. And yeah, just it's a big holistic reasoning for me versus just for health.
Okay, makes sense. So it's philosophical, not just health reasons, a combination of the two.
Philosophical, environmental, spiritual, you could say, yeah, I've done some things like shamanic journeys and other things like that. And my spirit animal was this beautiful big um, deer who came, and I'm like, oh, okay, I'm not eating you anymore. So you can look at it in a lot of ways. And I'm just very happy that science backs me up that eating a lot of plants is the good way to go.
Yeah, and I can't say I'm vegetarian, but I do agree that you want to eat a lot of plant-based foods.
Right.
I would recommend mostly plant-based, and I think you would agree if someone does choose to eat meat, like if they eat beef, it should be grass-fed beef, preferably organic. If they eat chicken, again, organic, maybe pasture-raised. You said sometimes you eat eggs and dairy, so I imagine when you do that, you try to eat organic, or I don't know. Do you prefer like raw dairy, or is it just organic, just regular dairy that's organic? Or
Yeah, organic. I mean, I think you have to be knowledgeable about the labels. So, like organic eggs doesn't necessarily mean uh, that they're healthier. That doesn't necessarily mean that the chickens had free range. So you do have to be a little cautious. And unfortunately, unless you have your own chickens, those free range options may be more expensive. But that's what I get for our family.
yeah, so like you get organic pasture raised then?
Yeah,
Yeah. Okay.
exactly.
Awesome. All right. And how about spices? I know you said for like with vegetables, you usually eat them plain, but I would
Oh,
think
I
with
do love
other,
spices though.
yeah.
Yeah,
So can you
absolutely.
talk about some of your favorite spices that you use with either what other foods? It doesn't have to be vegetables, but yeah, what do you
Yeah.
prefer?
Well, so it, I'm sure you've heard, you can guess what my favorites might be. So turmeric is certainly one of them. That vibrant yellow spice has that comes from the curcumina longa plant, and it's been used in culinary traditions for thousands of years. It's been used in Ayurveda and used for all kinds of different conditions. And it's one of its major constituents, that curcumin, which makes up like 2 to 5% of turmeric, really has so many therapeutic effects, everything from antimicrobial, um, protection against cancer, anti-inflammatory for sure. It helps to inhibit this NF kappa beta molecule that turns on genes related to inflammation. So whenever we talk about inflammation and autoimmunity, curcumin is one of my tops, and turmeric, whether it's used in golden milk or in a good curry.
All right, yeah, I think a lot of people are familiar with the benefits of turmeric, curcumin, even though a lot of people take it in supplement form,
Yeah,
which again, it has benefits too. Obviously, therapeutic value that way too, but also included in your food enhances the taste, and then
yeah,
you're still getting those therapeutic properties too.
yeah. Another one is ginger. I love ginger. Typically raw, it has gingerol in it, and that is anti-inflammatory and antioxidant. It's been studied more when we talk about uh, inflammatory conditions for things like osteoarthritis more than, um, say, Hashimoto's or Graves' disease, but it's been shown to have benefit comparable to pain medications for something like knee osteoarthritis. And so I do love ginger, that that I use in all kinds of ways. It might even just be taking some raw ginger and brewing it in hot water and having a ginger tea. Easy to do. A lot of people like to add some raw ginger if they are making smoothies. It adds a little bit of a bite to it, and I think makes it a richer taste. And so ginger is for sure another one of my tops. And then I love cinnamon. Cinnamon, we think about it for diabetes, for blood sugar regulation, and maintaining that even blood sugar is so important for lowering inflammation. And so cinnamon may activate these insulin receptors and inhibit enzymes that inactivate insulin. So cinnamon, top favorite, love it, on my oatmeal, and on a baked apple, on just about anything. I will highly recommend cinnamon. So I think those are my top three.
All right, well, those are a good top three. And so as far as diets goes, there's a lot of different diets. There's paleo, there's Mediterranean, there's now carnivore diet, there's autoimmune paleo, there's
Yeah.
again, do you have like a favorite diet, or are you of the mindset that there's not like a single diet that fits everybody? Or
Yeah. Yeah. I think that's probably been a little bit of my hard part in terms of writing a book or doing something, is that I don't think there's one best diet and only one diet that works for everybody. I do think that anti-inflammatory is the way to go, which means a lot of plants. That doesn't necessarily mean no meat, but it means very little meat to me. So the diets that are more meat heavy, I would say, are the only ones that I have a bit of a conflict with. I'm sure there are some people who feel great when they eat a lot of meat, but from my research, that's just not the direction that I recommend patients go. But when it comes to things like some of the diets, like, a lot of times patients are told don't eat gluten or dairy if you have a autoimmune disease, or don't eat grains. Those, I think, to me, get more nuanced.
And the nightshades as well are
And the
pretty
nightshades
common.
fall into that category as well. Yeah.
Yeah. And I mean, it's a little bit different. I mean, nightshades, obviously their health properties to tomatoes and eggplants and peppers, and everybody's different. So I mean, I'll admit that, my autoimmune patients, I do tell them to at least take a break from nightshades. I don't tell them to like avoid them forever.
Yeah.
And it's not to say that everybody, like there are some people that choose not to. Maybe they just follow more of a, paleo diet, eat some nightshades, and they might progress well. They might still do okay, but it's almost like play it safe. Let's see how you do without them. And again, eventually
Right.
have them reintroduce it. Whereas like gluten, again, I'm not, yeah, well, I could get I kind of know some of your thoughts too, because I mentioned I listened to some of your other interviews. Um, so I guess gluten I'm more strict on. Again,
Uh-huh.
the question is, does everybody need to avoid gluten forever? Or is it bad if they go, you're in Chicago. So if someone goes to Giordano's or another, should get some good old Chicago pizza, that's,
Right.
is it a bad thing to every now and then, have gluten? Um, again, so yeah, let's hear your thoughts on that. I mean, those listening to this kind of know my thoughts. I usually tell them, at least while healing, to avoid the gluten, even the dairy, nightshades. Again, maybe not as bad as gluten. Definitely not as bad, in my opinion, as gluten. Like I mentioned, have a lot of good health benefits. But
Right.
yeah, I'd love to hear what your, because I know it's different than what I think, which is fine.
Well,
That's
I mean, it may or may not be. To me,
Mhm.
I will oftentimes recommend for my patients who are coming to me initially with autoimmune disease, who are not feeling great, even on their optimized thyroid medication, for example. Um, I will oftentimes recommend a gluten-free, dairy-free uh, elimination, nightshades. I think we may do a trial of that, especially if there's some concern about leaky gut, and then
Mhm.
we're trying to do some gut healing. Then, to me, we need to eliminate all of the major things that could be exacerbating the inflammation while we give the gut time to heal. And because there's such a high prevalence of gluten, real gluten, of celiac disease, there's a higher prevalence of that in people who have diabetes and in people who have autoimmune thyroid disease. For one, they got to get tested, because it may coexist. If they have celiac, then it's, 100% no gluten. Sometimes no gluten, even in like your skin products and other kinds of things. So I think the question comes down to, is this a forever, is this a forever diet versus a temporary diet? And then it comes down to how does the patient respond to me when they reintroduce it after being off it for 8 to 12 weeks, and when we think their gut is healed. So I listen to the patient. I always tell my patients, I'm not just treating a lab or a number on the paper, even if it's like a food sensitivity test. We always have to look at the patient and what their response is.
Okay. No, that's a good answer. I mean, I look at it that way too, as more of an elimination diet, not a forever diet. Definitely with the nightshades, and with dairy. I mean, I can't say I've been dairy free. I dealt with Graves' disease in 2008, been in remission since 2009, and I can't say that I never have dairy. And even I can't say that I've been like 100% gluten free, where I haven't had any gluten, haven't had any cross contamination. I definitely agree. If you have celiac disease, you want to be super strict. And I think even if you don't have celiac disease, I mean, there are some people that choose not to like completely 100% avoid gluten, even if they don't have celiac disease. And I mean, there's no need for us to have gluten. But I think, I guess some will say it's playing with fire. If you have a history of autoimmunity, that even if you don't have celiac disease, it could cause problems because it could potentially cause permeability of the gut, as you
Yeah.
mentioned with that. And to me, it does depend on the person. Again, for the most part, I am gluten free, just because, like you, I'm eating whole healthy foods. If you're eating whole healthy foods, you're typically avoiding gluten. But like I said, I can't say that I haven't strayed, I haven't fallen off the wagon, every now and then. And just yeah, so it sounds like you maybe share the same thoughts, where it's like, some people, if they don't have celiac disease, might be okay if they occasionally get exposed to gluten, that it's not going to be a problem with everybody.
Well, and for me, some of my patients do, whole grains I think are very healthy. So I tend to be whole, the quality, it's not just the quantity, it's also the quality. And you don't know, you've probably had reports of this too. People who go to Europe and they're eating Italian pasta and bread, and they're like, I have no issues here. And then they come back here and they're like, so some of it may be the pesticides and the other things that are used, and not necessarily the gluten itself. A lot of it is, I have patients who eliminate and they feel great, and then they have no desire to do it. And then they know, like, okay, if I go and I eat this birthday cake, I'm not going to feel so great the next day, but I'm not causing permanent harm. And then I have others who have families, and it's just for them easier. They don't feel differently after doing an elimination, and their gut is in a good place, even with gluten. And for them, I say it's fine to keep it in moderation. So I think I'm a little more lenient on those. Nightshades are same thing. They have alkaloids in them, and I think some people do have reactions to them. But those tomatoes and peppers and those, all of those bright colors, lycopene, that has so much health benefits too with those polyphenols, that I hate to cut out a whole category unless somebody clearly has a reaction to it. Yeah. So this is where I get into, like, maybe we got to test and see what's going on when you're eating those things. And then if we eliminate them and you get better, then maybe that you are reacting to them.
Yeah, and you also mentioned the quality, which is important too, because someone might say, "Well, I went out to eat and I had a gluten-free pizza and also used either no dairy cheese, like non-dairy cheese, like the diet, or just had no cheese." But then the quality, like, is there, there's probably glyphosate in the in
Exactly.
whatever dough they're using, and then also the oils that they're using are probably
Right.
not the healthiest. So, some people get so caught up on the gluten and dairy and other allergens, but don't look at, well, what kind of oils are they cooking with, and that's not really good for you. And again, it's not. Yeah, it's one of those things where, people, they want to live, they want to go out to eat, and same thing. Every
Yep.
now and then, I want to go out to eat, and I can't say I'm perfect all the time. But again, I guess some people get so caught up on the gluten free, dairy free, and they overlook other
Yeah,
sources like
other
the
aspects of the
oils.
diet.
Yeah.
It's like when you go back to the 70s, 80s, when everything was when fat was evil. And so everybody was like, "Oh, I'm eating healthy. I'm eating all of these fat-free Snackwell cookies." And and then of course what happened, now we have this sugar diabetes epidemic. And so what are people replacing gluten with? If they're eating all of these gluten-free cookies and other gluten-free processed foods, that's not moving in the right direction for sure. Like, I would rather have somebody have a clean whole wheat piece of bread than gluten-free cookies full of sugar and processed vegetable oil. But that's me.
I mean, it's a good point. Like you could go and get, like the Ezekiel bread, like the ancient grains, organic, and like, is that worse? That, again, that's not gluten free, but so is that worse than eating gluten free Oreos? Which who knows what else, what the
Exactly.
gluten free Oreos has. I mean, again, there are healthier gluten free cookies that are
Yeah.
dairy free and have everything natural. So that would be a more interesting conversation, I guess. But as far as comparing, yeah, I think I would go with the Ezekiel bread over I mean, maybe taste wise, people would prefer the Oreos over but
Yeah.
again, yeah, the gluten free Oreo. Again,
Right.
who knows
You got to
what
look at
else
the
is
whole
in there?
thing. Yeah, if you're doing whole foods, that's one thing. I mean, we're running into the same thing with all of like the plant substitutes like Beyond Meat and other kinds of things that are just rich in saturated fat. Whenever you try to eliminate and replace, and industry makes something that's artificial, it never turns out well down the road.
Yeah, definitely agree. How about oxalates? Because there's, I interviewed Sally K. Norton, who wrote a book, Toxic Superfoods on Oxalates, and there's at least one lab, the Great Plains, who now is Mosaic Diagnostics, who does urinary testing for oxalates. So you can't completely eliminate the oxalates, but are
Right.
you concerned at all about like really high oxalate foods like spinach or Swiss chard?
Yeah, and it's a bigger category too, yeah, so spinach, kale, beans, chocolate. Chocolate has oxalates in
Sweet
them.
sweet sweet potatoes, yeah,
Yeah. Yeah, so this whole idea of these, anti-nutrients kind of thing, and do the oxalates, um, back to the gut, do the oxalates irritate the gut lining in some people, causing leaky gut? Um, so some of it may be gut. There's some studies about oxalate affecting some of our immune cells, these monocytes and macrophages, and having them release pro-inflammatory uh, cytokines and chemokines. And, what can I say? Again, I think it's an individual sensitivity. Those foods are healthy in general. Traditionally, we've always thought of oxalate elimination for people who had kidney stones. Now the question is, do others need to? I just recommend balance. If you look at like, if you're trying, this is where I think people get nutrition confusion, because they'll be told like, okay, eat a low oxalate diet, and what's a lower oxalate diet? Broccoli. Oh, but I can't eat cruciferous vegetables because I was told they have goitrogens in them. Okay, so I can't eat oxalates, and I can't eat goitrogens, and I can't eat gluten, and I can't eat dairy. And then they end up on a super restricted diet and get malnourished, don't enjoy food, have orthorexia. So I think, for me, it will usually come back to moderation. If we have moderation, if somebody's not eating handfuls of, spinach and kale every day, then I'm not going to eliminate it from their diet.
Yeah, I agree. I agree. With the spinach, I will say I used to stuff my smoothie with spinach, and then I did just randomly an organic acids test that showed I had high urinary oxalates, and that was one of the major changes I made. It's like, okay, I could always not to say I'll never have spinach, but there's other substitutes for spinach. But I can't say that I tell people don't eat sweet potatoes, don't eat dark chocolate, don't eat, I
Yeah.
mean, it's really difficult. And like you
Well,
said, when combined with other foods, like, yeah, people could just, ends up with hardly anything to eat if they, not just the
right.
oxalates, but the lectins, the goitrogens, and other compounds,
Yeah.
other.
And it's individual. Like, again, we have to remember that we have different genes. And so some people have a gene that may lead to a problem with oxalate breakdown. And so they do have a problem with it. And, and maybe that's you because you saw on the test, like you had high oxalates in the urine, but that doesn't mean everybody has that. And it also relates to the gut and the gut microbiome, because the gut bacteria are involved in how we metabolize things. Our nutrient status, involves how we counteract oxalates. So it's so complex that any broad generalization always turns me off.
Yeah, I know, I get it. So
But
before we
I
wrap.
like that you tested. That's the answer. You individualized it to you, and then So that's really the best if patients have access to integrative functional medicine practitioners who can help refine what they need. That's always going to be the best.
Yeah, and even in my situation, I cut out the spinach, but I can't say I really made a lot of other changes. Yet when I did a retest, the levels dropped significantly. Actually, they were within the normal limits. And I mean, according to Sally K. Norton, that might not mean someone still doesn't have oxalates. But anyway, on the test itself, it still looked a lot better without the spinach. So it's not like I cut out sweet potatoes. What it's not like
Yeah.
I wasn't eating any nuts and seeds. It was just that spinach is one of the higher ones. And again, I'm not saying never to eat spinach, but I was just like loading, like you said, loading my smoothies, with
Yeah.
spinach every single day. So yeah, just like you said, everything in moderation. And
Moderation. It's my mantra.
yeah. So before we wrap things up, I did want to talk a little bit about seafood because I know, again, for besides philosophical reasons, are there also concerns like because I have concerns about also the environment and the heavy, not just heavy metals, but like PCBs. Do you also have those concerns if someone says, well, if I want to have fish, would you be like, well, maybe have it, but again, moderation, like 2 or 3 days a week rather than every single day because of the
Yeah, yeah,
lectins?
and I think if there were, if there's one category beyond it, I'm sure you've seen this. It's sort of like there, there's the roots. That's the best. Like have a lot of roots, and then the fish is the next category, and then you stay away from, for me, the 2 leg, the 4 leg. They kind of get progressively worse, and so I tend to say like, yes, if you're going to have some fish, especially those omega-3 fatty fish in moderation, though that I think can be a healthy part of an anti-inflammatory diet. And but like you said, not a lot of high mercury fish, get good quality, and don't overdo it. Do moderation.
All right, excellent. Anything else that you wanted me to ask you that I didn't ask you, or anything that, or did you want to just like, for
Riff
those
on
who I guess,
anything.
what was that?
Riff on anything. No, no. I mean, I think, I think people with autoimmune disease, thyroid disease, we're gaining a better understanding of different medications that can be beneficial, different alternative treatments like low dose naltrexone. And, I see, all right, here's a more eloquent way of saying it. I see a lot of patients who come in, not a lot. I have some patients who come in who say, I don't feel well. I need to change my thyroid medication. Or, oh, I'm not feeling well. I think we need to tweak my thyroid medication. And sometimes that's the case, but a lot of times it's these other things like lifestyle and diet and stress and not getting enough sleep. And those are the things that are the factor, not finding that magical proportion of T3, T4, and so I guess that's the bottom line, is that sometimes that helps, but ultimately you need to have a great base for your lifestyle.
All right. Yeah, that's amazing that you do that because yeah, a lot of medical doctors would just adjust the dosage of thyroid medication and that's it. So it's great that you obviously incorporate all the diet and lifestyle stuff that we've been chatting about here. So yeah, and can you let people know where they could find out more about you? Share anything you'd like, your website, and again, any
Yeah,
place people
probably
can
the
find
best
you.
thing is my link in bio because it has links to everything. So that drmelindaring.com has links to some free downloads on anti-inflammatory culinary medicine, little booklet I created, and to my Instagram and my website at Northwestern and all kinds of things. So if they just go to drmelindaring.com, then they can link to whatever they like.
All right, awesome. You're on YouTube and TikTok, or
A little bit. I'm not so consistent. I need to get better.
yeah,
But
that's
yeah,
okay. I'm on YouTube, but yeah, haven't as of recording this, haven't done any TikTok videos yet, so that's okay. All right. Well, thank you, Dr. Melinda. It was a great conversation. Appreciate you being open and honest about everything. And just yeah, I agree with a lot of what you said. Moderation is the key, as we all know, but we sometimes lose sight of that.
yeah.
And again, thank you so much for your time.
Yeah, I enjoyed it. Thanks, Eric. Have a great day.
You too. Thank you.